Hi, everyone. Welcome to Vaccine Watch Wednesdays. I'm here with Kelly Smith, our public health nurse, again to answer some questions. And wanted to this week talk about kind of those more severe allergic reactions that we've all heard about in the news, just a few here and there. What do you know about those, or what can you share with us, Kelly?
So Susan, there have been a small number of people who have had some severe allergic reactions to the vaccine. However, it's very small in comparison to the number of people who have received vaccines. Up to this date, we have vaccinated millions of people, but we've just got a handful of people who've had those allergic reactions. So it's still pretty rare. And if you think about it, we have never vaccinated this number of people all at one time. And this is a very popular news item right now. So any attention that's going to grab, they're going to put it out there. So it really isn't any different than any other vaccine. It's just we're hearing about it more.
Okay. So how do you explain to people if they have had kind of some history of any sort of allergies or allergic reactions to different things, if they're the person that should really not get this or talk to their doctor more?
Okay, so if it kind of depends on what kind of allergic reaction they've had. If they just have like spring or fall allergies, a little bit of hay fever, they are at no higher risk than anybody else in the population. And if you fall into that category and you go to get your vaccine, they are going to ask you to wait in the waiting room for 15 minutes or somewhere in the clinic for 15 minutes just to observe you and make sure you feel okay before you walk out the door. Most allergic reactions are going to occur in the first 15 to 30 minutes, so you should be covered during that waiting time. The other type of reaction, that the one that people are more concerned about and the one you're hearing about on the news, is called anaphylaxis. And
Yeah. Okay.
that is a severe allergic reaction. So if you have a history of anaphylaxis or severe allergies to any vaccines or any type of injection, that puts you at a little bit higher risk. Or if you have an allergy to a component in the vaccine, in that case, they're going to ask you to not get it and consult with your doctor or allergist before you go to get the COVID vaccine.
Okay. So that helps distinguish between like allergies, seasonal or
Correct.
food or something like that versus what you've described. That's really helpful.
Correct.
So
And
say I am one of these people that ends up getting the vaccine, and by whatever chance I've been asked all these questions and talked to my doctor, but I get the vaccine. How am I going to know in that moment? Am I having one of these more severe allergic reactions? Like, what am I watching for, or what am I feeling?
um, so a severe allergic reaction really is demonstrated by a difficulty of breathing. You feel like your throat is swelling or closing up. Um, you might get a bad rash all over your body, feel dizzy or weak, but usually a sign that it's really kind of going down that path is that difficulty breathing or swelling of your head, neck,
Okay.
airway.
Okay. You
Um,
definitely know it.
yeah, you would know it.
Okay.
And if that happens, it usually it's going to occur in that first 15 to 30 minutes. If you have a history of allergies, they're going to ask you to stay for 30 minutes and
Okay.
make sure you're okay. If it happens while you're there, make sure you alert the personnel at the clinic or pharmacy where you're getting your vaccine, like, hey, I don't feel right. They're going to have the epinephrine or Benadryl, whatever kind of medication that they feel is necessary to give you, they're going to have that on site to take care of you. Um, if in a very small chance it happens after you would leave the clinic, you would want to call 911 and get to a hospital right away.
Okay. Good to know. Thanks for explaining all of that, Kelly.
Sure. Oh, and there's one more thing. When you do go to get your vaccine, they should ask you if you would like to sign up for a program called vSafe, and it's a smartphone-based program. It's on a website, but you can scan it. They'll have like a little barcode you can scan with your phone, or you can just enter the web address into your browser, and
Okay.
you can register, and put in the information like I got this vaccine on this date, and they're going to send you like daily checkups to see how you're feeling. And that's just giving us more information about the vaccine because it is so new. We just want to gather more data, so that we have more information to tell people in the future.
Okay. Say the name of the website one more time.
It's called VSafe, and
Be safe.
they'll have
Vaccine
information about
safe.
it. Yeah, when you
Okay.
go to get your vaccine, they should be able to show you how to get to
Okay.
that.
But important to register so that we can look more
Absolutely.
and see what's happening with everybody. Okay.
Absolutely.
Okay. Thanks so much.
You're welcome.